Welcome to The Consult Before the Cut, your go-to podcast for all things anti-aging, aesthetics, and plastic surgery. We are your hosts, Brittany DeSherry, Taylor Besh, and Dr. Jonathan Weiler, and each week we'll dive deep into the latest trends, expert insights, and we will bring real patient experiences from the world of beauty and wellness, aesthetics, and plastic surgery. Hey everyone, I'm Brittany DeSherry. I am the COO of Rejuvime Medical, an anti-aging clinic here in Baton Rouge. I am also a nurse. I have here with me Dr. Jonathan Weiler.
Yep.
He is a board-certified plastic surgeon over at Weiler Plastic Surgery Group.
Yes.
With over 20 years of experience.
Getting a little older, yes, 20 years. 20 years.
And then we have Taylor Besh. She is an expert injector at Weiler Plastic Surgery as well. And I mean, Taylor, you've got 14 years of experience injecting now.
Yes, indeed.
Yes.
Great.
Love it.
So we are going to dive into some fun topics each week and kind of get into the nitty gritty of all of them. This week, we are going to talk about baby Botox.
Yes.
The new hot trend.
Baby
Yes.
Botox, the trend in the aesthetic world.
Yeah. So Taylor, you are our expert injector. So obviously we have a lot of questions regarding this. So first, what is baby Botox?
Yes. Explain this. Is
I'm
this
like, what
babies
is
coming in?
this?
I know more than that, but tell me.
Baby Botox.
It's quite a name, right?
Baby Botox is not involving children or infants. Baby Botox is a traditional Botox neuromodulator treatment that is done in smaller dosing to give you a more natural approach. It is the perfect segue from thinking about Botox, thinking about trying, a little bit, to doing it. It's been a good psychological thing for patients stepping into the aesthetic world. It's less intimidating because you're doing small dosing, getting little bits done to help prevent.
So what's the
wrinkles.
difference between like baby Botox and regular Botox? Like, was there
The
traditional
amount
Botox, if you
of
will?
units. So Botox is priced per unit. It is treated per area. It depends on how many units you place in the area. So like a normal dosing for we call it the 11 lines right here, would be 20 units of a traditional treatment.
Okay.
Baby Botox would be 8 to 10 units.
So it's like a kid's meal.
All right. Yeah.
It's like,
Like a kid's meal.
yes,
It's a happy meal of Botox.
It's a happy meal of Botox, right?
exactly.
All right. So let's educate our viewership and let's bring it back. And some people, you don't even know what Botox is, right? So
That's right.
Let's kind of break it down. What is Botox? How did it start? What does it do? Kind of walk us through.
Botox, let's first say that is a brand, and the general term is a neuromodulator. So a neuromodulator is Botox, Dysport, Jeuveau, Xeomin, Daxxify, newer in the industry. All of those are basically the same thing. They're called neuromodulators. Botox is the known brand name that we use,
So
like we're talking right now.
If I drive a truck, so if I'm going to go buy a truck, I drive a Ford.
That's right. That's
Ford,
right.
Chevy,
Yes.
right?
Different brands. So
Right.
that's what I always say. He used to say this.
Yeah.
Botox and Dysport's like Chevy and Ford.
Right.
Different brands, but do basically the same
Right.
thing.
And Botox
Yeah.
just happens to be called Botox.
That's right.
Yes.
Because it was number one to the game.
That's right.
And it's an excellent product. And really dominates the market. But there are lots of neuromodulators out there.
That's correct.
Sure.
Yeah.
So what does it do, right?
Yeah.
So
What's the purpose?
the purpose is to soften muscle movement. A lot of people use the word paralyze. I do not use the word paralyze in my clinic. It is relaxing a muscle for a certain amount of time to prevent a wrinkle. So say he's 50 years old. He's been making the same
Which I
facial
am.
expressions for those 50 years, focusing in surgery. So he pulls and animates in a way that he is now developing etched lines into his skin, right? So the Botox is placed into the muscle to relax that muscle, causing the wrinkle.
Okay.
Okay.
Tell us how it's administered, right?
Yeah,
Is that what you're gonna ask?
that's what I was about to say. So, like, how do you assess and then how do you administer these patients that come in and they're like, "Oh, Taylor, I have all these lines. Please, help me."
Yeah.
What's that
Right,
process?
and we
look
are going to
like?
bring in a patient. We always
Yes.
in this podcast we always bring in a patient, talk about our experience. But tell me from an expert injector standpoint, Just like Brittany said.
Yeah, like what do you do?
What do you do? How do you administer?
The way that the process, right? So the process is a patient comes in, you assess their movement and their muscle activity. How strong are they in their facial muscles? Then you talk about the result that they want, and the duration that they want, right? So if, say somebody comes in with just their 20 years old and they come in with a little bit of activity right here that's causing little lines, we're going to do a decently conservative dose. Somebody that's 40 or 50, very strong muscle,
full dose,
full dosing will be done then.
The baby's getting the kids meal, the baby Botox, right?
You're getting the Big Mac.
And I'm getting the Big Mac.
You're getting the Big Mac.
Oh, I have Big Mac.
So Botox is injected with a very, very small needle into the muscle group that you're treating. It is then going to relax the muscle activity and last you for about 3 months.
Okay.
When the muscle is relaxed, the wrinkles are softened.
Onset. How quick?
This is going to take about 5 to 7 days to start to see it. 2 to 3 weeks is your sweet spot.
Okay. So we've got a big tailgate this weekend. We're at Baton Rouge LSU. Today is Friday. It's a little bit too late.
That's
to
right.
Look great tomorrow.
That's right.
You'd have to look great for next game.
And that's up and coming emergency Botox that we will hopefully be getting in the next couple of years.
Right. Awesome. Maybe
quick onset, but only lasts for about a week.
My electric Ford.
Yes.
Right. A little bit differences, right? Okay, cool.
That's gonna come in handy.
Cool.
So wait, who's coming to get this baby Botox? Like,
so talk. Yeah, I mean, so
who's this for?
I'm 50. I've been in practice for 20 years in plastic surgery almost, and Botox was just starting when I was coming out. Right. It was brand new, and I do a lot of facelifts, and my facelift population usually goes from about 50 to literally 90. My ladies and men 70 or above are not believers in this stuff, right? Our generation, and you guys are a little bit younger.
I think it was a little taboo in the 50 to 90.
Yes, absolutely taboo, right?
Very new, very skeptical.
You're putting a toxin in my face. Yes. What is this going to do?
Right. Now, 40 to 50 was the sweet spot.
Oh, yeah.
Because it was introduced. They were starting to see results. The results were working. And then it has kind of trickled down.
It has. Right? I mean, my generation has bought in hard, right?
Yeah.
It's hugely
But you
popular.
started late. Your generation started late. So that's where baby Botox comes in, right? Is that it has trickled down. It is accepted. But they're starting much younger. Hence, not having the deep etch lines. Wanting to just tiptoe into this world and see what it's all about. And that's why baby Botox is the perfect fit for that 20 to 30 year.
So they're not using, is this fair to say, so this generation in the 20s, the baby Botox generation, they're not using to treat, they're using to prevent.
Well, that's
Does that sort of make sense?
Yeah, that's
so
what
it's almost like
yes.
a skincare regimen, right?
Yes.
They're starting on this regimen, and there's different rules probably applying in this world of our 18 to 20 something, 30 something ladies, that it's a different set of rules, and it takes a different eye, right?
That's right. That's right. Yeah, they're preventing. I mean, heck, my 8-year-old is using skincare. I didn't know what skincare was until I was 20, which is a good thing.
My kids are SPFing every day, and I'm like, okay, I can't wait to see your skin when you're 30. This is going to be amazing.
Well, because skin cancer is a real epidemic. And not quite. My generation was just kind of touched into that, laying on the roof with baby oil, betadine. That was really prevalent. 50 or above. My younger sisters, our kids are very aware of skin health.
Yes.
Like you said, your girls.
My girl. Well, and that's right. I was a tanning bed. I mean, in high school, the tanning beds, that was a
illegal.
thing.
Is it illegal in
like,
some places?
I hope.
I don't even know if, tanning beds are a thing anymore, but I'm like, my children go outside and they're immediately just like, I need sunscreen.
Right. Yeah.
And
which
that's
is a good
wild
thing.
at 6 years old.
I mean,
I say skincare, baby Botox, it's a marriage. It goes together. You're preventing movement, which is causing wrinkles, but you're also thickening the texture and the strength of the skin. So it's the perfect combination. These kids are going to have flawless skin. Facelifts are going to go down
you're right.
in 30 years.
Right. No, we are really creating, as a society, I feel like we're becoming much more aware of our health.
Yes.
Yeah.
Much more aware of our beauty. I mean, you guys, this dates me, but growing up, I used to watch Three's Company and so some of these shows, right?
I don't know what the heck that is.
You don't know what it is,
that's
but
Nick
like
at Night.
Mr. and Mrs. Roper. So it's kind of like a trending thing on TikTok. You'll see every once in a while. And when I was like, I was like 10 or 12 watching it, and I thought these people were so old. And you look at their pictures, they were 47 years old, and they were being treated like they were getting. Archie. You ever watched Archie Bunker? I don't know if you remember that.
No.
All in the Family. I mean, that's really dates me, but that guy was in his late 40s. It's crazy.
It is.
The appearance of both male and females. What we're able to do. That's why I love the world of anti-aging. That's why we got Rejuvime. That's why love the world of aesthetics. And it's amazing how aware our younger generation is becoming, and they're using these tools, right? So to me, baby Botox is just another tool.
Absolutely.
Just another tool.
Absolutely. It is part of the preventative process. They are invested in themselves and their skin. It is the perfect, and budget wise, they're young and they have to be budget conscious.
Right.
Yeah, you're not going
So
to get...
it is not breaking the bank for them either.
Before we bring in our patient, talk to me about how the rules change when you go younger. Does that make sense? In other words, somebody in my age category comes in 50 years old, and I know you're using full dosage, but talk to me about how you assess, what are their concerns. Does that sort of make sense?
Yeah, so every single patient is different. Age, gender, every person, every consult is completely different. But somebody that comes in the younger 20s, and they tell me that they are here not for a crazy dramatic change. They don't even really want their friends to know, and they want to soften their look but stay natural. That's where the baby Botox topic is coming up.
Okay.
So that is, yes, let's treat these areas. Let's prevent the lines that are forming, but at lower dosing. Now, on the flip side of that, he comes in, and it's a male that's very expressive. They're going to get a normal 64 unit
I got a very heavy brow.
dose. That 20-year-old is going to get a 20 unit dose for the whole face. So it's very different it is specifically the unit.
So you're still treating the whole face, just at a lower price point.
Yeah, like it's same thing, cut in half.
Cut in half.
Basically.
Cut in third.
Cut in third.
I have a 17-year-old. She has this little pesky line right here.
Right.
She's obviously comes in with her parent because she has to be 18. And we put 6 units every 3 months.
Right.
She stays on top of it. And, she just doesn't want that deep etched line. So we've been doing that since she was 16 and staying consistent with it.
For the kids that are kids, I say kids, that's terrible. For the
20-year-olds.
20-year-olds, for the 20-year-olds that are doing this, these girls that are starting earlier, coming in, asking for this baby Botox, and they're getting it done every 3 months, is that going to possibly, like, when they become 30s and 40s, are they still going to require lesser amounts, or do they have to get are they going to start getting more?
That's a good question. Okay, so Botox causes, it's a fancy term, atrophy, right, of a muscle. Atrophy is weakening of a muscle. I always say it's like not working out your biceps for 3 months, not working out your bicep for 3 months. The muscle's actually going to shrink down and weaken.
Okay.
That is very valid.
So it's actually decreasing in size.
Going to yes, it will require lower dosing in the future because the muscle will not be as strong as it could have been.
Okay. So you're saying, like, most of these kids, like, obviously me, I didn't start Botox until I was in my 30s. So I was kind of working up, kind of going up a hill, trying to, like, get
catch
everything
up.
back.
Yeah.
So if they're starting in their 20s and they're consistently getting it, they may not need the amounts that, our 30s, 40s and stuff right now that are
valid,
getting to.
very valid, yes.
We think, definitely. All right.
One negative with baby Botox that we did not talk about, the duration is shorter.
Really?
Dose equals duration.
Okay.
A full dose of Botox is going to give you a full duration of 3 months. Baby Botox, I say it's a baby duration, so it's just not going to last as long as full dosing.
Okay.
It's still going to give you that preventative aspect, even if you do it 2 to 3 times a year. We want you doing it 4 times a year, but
in my mind, even just a consistent weakening of that muscle, so it doesn't start to overpower your skin. It doesn't create that very deep crease. I always use this as a very male explanation, but I always use the explanation of cardboard. And I tell patients, your skin's sort of like a cardboard, nice and beautiful and thick. If you bend it once or twice, it's fine. But if you start bending it hundreds of times, that crevice gets really deep.
Stays etched.
Right. And so, if we can weaken those muscles over time, you decrease your need. It lengthens the effectiveness.
That's right.
And you're telling me it can also, in terms of cost, be a little bit
more
lighter,
cost effective. Right.
Yeah.
on the pocketbook as you get older.
Yeah,
right. It's
absolutely.
sort of that, like if you take good care of your car with preventative maintenance,
Yeah.
you're not going to have your engine blow up.
Yeah.
Right. And it's a very good thing.
One question here. You talked about injecting with like the T90 little needle and all that. Does it hurt? Is it painful? Like, is there any,
That's
is
a
there
good
any
question.
downtime or?
So painful, I would say no, and I am the biggest chicken of all chickens. It is a little tiny
you've had
pinch.
4 babies. You're a tough lady.
A little pinch
Women that
in
have
the
babies
area that is over in like 0.2 seconds. So
Okay.
it's always
Enough.
the unknown.
Yeah.
Once you do it, you're like, I got this.
And I want to say
That was
this
nothing.
It's a
from a male
breeze.
perspective: women are much tougher than men.
100%.
I agree with
women
that.
from I see it with my daughter. I have a freshman in high school. Women from a young age are taught to endure pain to look beautiful. Right, plucking your eyebrows.
Absolutely.
I hate when my wife starts to try to pluck my eyebrows. It
It
hurts
is
so
pain.
bad. Oh my goodness.
pain.
It is less painful than plucking your eyebrows. I can tell you that.
Yes.
Definitely.
Yeah.
You do- but it's very, very tolerable. I think a lot of it has to do with the skill of your injector.
Absolutely.
And if you have an expert injector, I think it's the pain.
I mean, we can use an ice pad.
Yes,
You
lots
can
of-
use numbing.
lots of
That's a little
distraction
extra
techniques. Oh, yeah.
distractions.
Yeah.
But it's very, very tolerable.
Good.
Perfect. And you, like you said, there is downtime. Is there any downtime after you
So
get it?
this is my little spiel. Upright for 4 hours. Do not massage anything in and work out tomorrow. There's an old wives' tale of move the facial muscles that you injected to help it incorporate. That's baloney.
'Cause you don't wanna
carry
disperse-
on. You just want to leave it
Yep.
alone and go about your day.
You don't
Can I
want
wear
to
a
move
hat?
No, I don't want you wearing a hat. If we're
Okay.
treating your frontalis,
Okay.
I don't want
I
anything
just-
touching here.
Okay.
Makeup apply.
Makeup can be applied.
Okay.
Okay.
Perfect.
Well, good. Well, good.
All right.
All right. Any other questions, Britt, for our expert injector?
Yes.
Yeah, I know.
Let's
I'm
bring in
like,
our
I know.
patient.
Yeah, let's bring in our patient.
bring in our patient. Let's talk to her.
One of the real focuses of our podcast is we hope to bring in a real patient experience with everything we discuss, right? Whether it's if it's a tummy tuck, if it's a breast aug, if it's a Botox, if it's a filler,
right.
if it's a hormone,
Yeah.
if it's testosterone, if it's GLP-1s,
Mm-hmm.
right? All the way to eyelashes, right? And we want to have somebody come in, tell us their experience, what drove them to do it, and how it went. So stay tuned. We're going to cut, and we'll come right back. We'd like to thank our sponsors, right?
Yes.
We've got 2 main sponsors of this podcast, Weiler Plastic Surgery Group, the largest aesthetic plastic surgery group in the state of Louisiana, right? And then Rejuvime Medical, right?
Yes.
The largest anti-aging clinic in the state of Louisiana, and we are spreading quickly.
Yes, and
Yeah.
Mississippi. Like
Yeah.
we're tiptoeing into Mississippi now.
Yes, ma'am.
Love it.
Rejuvime specializes in male and female hormone replacement, GLP-1s,
Yes.
right? We also do aesthetics over there also. We have expert injectors over there also.
Yeah.
So stay tuned. We'll be right back.
From Botox to tummy tucks, we provide patients with real confidence. Weiler Plastic Surgery. Something real.
My weight's always kind of fluctuated throughout the years. I've worked out, did CrossFit, worked out on my own. You know, my weight kind of goes up and down. I do good for a little while. COVID kind of came around and just put on a lot of weight, and then that's when I heard about semaglutide with Rejuvime. I dropped the weight fairly quickly. Being a dad, taking it, you know, I feel revitalized. I feel like my old self. I have a lot of energy. My experience at Rejuvime has been awesome. It's very easy. Everybody's friendly. I would definitely recommend it.
All right, welcome back. We are here with our patient. This is Parker. Parker is a patient over at Weiler Plastic Surgery Group who has received baby Botox here in the past. So welcome, Parker.
Welcome.
Thank you for coming and talking to us about
Yeah,
this.
appreciate it.
Parker, You ready? You're on the hot seat,
hot
girl. So first, we're going to ask you, how old are you currently? And when did you start doing baby Botox? Your skin is flawless. So tell us
You
the
look
tea.
wonderful today. You really do.
So I'm 23. I turned 24 at the end of the month. And I started whenever I was 21, so my senior year of college.
All right.
Why did you start baby Botox at 21?
Honestly, I was like, why not?
Okay.
You know, Weiler Plastic Surgery has a great social media. So, you know, I've been following it for years. And I was at a point where, you know, I was making money as a senior in college. And I was like, why not splurge on myself? I actually got it for my birthday. I was
Oh, really?
turning 22,
Okay.
yeah. And so I...
Fellow October birthdays, right?
Yeah. I was like, why
Scorpios.
not? And, you know, the Weiler Plastic Surgery Instagram does a great job of educating on Botox, you know, and just injectables in general. So I was like, why not? YOLO.
Was this like a thing that, because obviously like when I was a senior in college, like I wasn't talking about getting Botox. Is this just like something that your generation, y'all just chat about like Botox is a thing?
Oh, yeah, absolutely. And I think the first like big thing that people might talk about is filler. Because, you know, everyone gets their lips done
Lips,
now.
right.
And, you know.
So do you think that is more of a topic over baby Botox or Botox in your generation?
I would say so. Because,
Really?
you know, like you see a girl walk past and me and my friends are like, I've totally got lip filler.
But also like crow's feet for days.
Right. Drives you crazy.
Crow's feet all day, but her lips look fantastic.
Yes. Yes.
Okay.
Yes. And also, like, one of my friends, she doesn't get lip filler, she gets lip flips.
Okay.
And that's also kind of, you know, we see like a subtle difference and we're all like, oh, what did you get? And she goes, I got a lip flip.
And that's sort of a form of baby Botox, right?
That's right.
A lip flip.
Yeah.
Explain what that is real quick.
So a lip flip is placing Botox above the lip in your orbicularis oris muscle. Very, very small dosing. Whenever you relax this upper muscle, it just allows your lip to roll back when you smile and animate. I always say it's the gateway drug to lip filler. So it gives you a little taste of what a little bit of an enhanced lip looks like. It only lasts for about 10 weeks, so that's why we kind of graduate to lip filler, but it is beautiful. If somebody pulls in and they smiles, it just rolls
Especially
it back really
a young,
pretty.
beautiful,
Yes.
full lip,
Yes.
right? I mean, as you age, you lose the volume in your lip. So lip filler is really, you know, to look younger as you get older, necessary.
Yeah.
But in a young woman, to really enhance.
Who has the volume.
Right?
Yeah.
You can always put more volume, but if you're enhancing volume, a flip is wonderful.
Yep, absolutely.
Talk to me about, what do you think, why is this trending? Why is this a hot topic? Do you think this is something that's just like a natural evolution, like you said, girls starting with the lips initially and then just becoming more aware? Because you're very active on social media, right? All y'all's, I mean, my kids don't even watch TV; they watch social media all day, right? And so, tell me what you think about your generation.
I think social media plays a huge part of it.
Okay.
Like, you know, you see all these TikTok influencers and they're kind of sharing their experience of them going into an aesthetic office, you know, and then, you know, just celebrities, you know, like, for instance, like Kylie Jenner, like the Kylie Jenner lip challenge, you know, everyone was starting to get lip filler because, you know, she was 16 and getting her lips done.
Right.
And so social media plays a huge part of it. But then, like, you also, you know, in Modern Family, you know, for example, there was a funny episode where Jay went and got Botox before a cruise and his face got messed up. So, you know.
You got to be careful who you go to, right?
So, you know, TV shows, they're kind of doing little episodes on it. So that's how I kind of got introduced to it, through social media and television.
Yeah, and more accepted. I mean, it's very. So tell us about your experience. What did you go in for? What was the experience when you were receiving it, and then what were your
talk
results?
about like your very first initial Botox. Like, what's your mind thinking? What do you?
I didn't know anything really. Like I knew like from what social media told me, but I didn't know like the whole consultation part of it. Like it wasn't. I thought I was just gonna go in and be like, okay, I don't like my right here. But you know, I walked in. It was a very like welcoming environment, like no judgment. And then
Judgment-free zone.
Yeah, judgment-free
judgment-free
zone.
zones.
You know, we're all here
Yeah.
for the same thing.
Yeah.
So,
We're all getting it.
so like I walked in, you know, sat down, they took pictures, and they're like, "What are your concerns?" And I was like, "Oh, like kind of right here."
Right.
And she's like, "Okay, well, you know, the instructor's going to do like a full face consultation with you, and then you know she'll discuss like your needs, your goals, all of that jazz." So
Let me ask you this: did you think that was important to have somebody come in and talk to you about like your full face, or did you just want to get in and get out?
Absolutely. And you know, I've gotten baby Botox now for a couple of years, and you know, you can't just treat one area; you have to treat like the whole thing because you know it's just gonna look weird.
Yep.
Yeah.
So I kind of went in only wanting one area, but my injector talked to me, and we actually wound up doing like the entire forehead.
Really? Okay.
Yeah. So it was really nice, and she only did it micro because I didn't want like frozen. So she only did half of the units, which was great. Because I didn't want something like noticeable. I just wanted something subtle. And what she also pushed was skincare too.
Okay.
So it's also very important to do like a good skincare routine with it. So that's what she did, and the needle was like this big, so it wasn't something like huge,
Right.
like getting a shot at the doctor. And I'm kind of scared of shots. So
Are you? So were you like fearful
Well, I
at
was
first
gonna say,
when
were you like,
yeah, a little bit, because I didn't know. Like I didn't know.
It's the unknown.
Yeah, it is the unknown. But I'm not gonna lie, I thought it felt good.
you did?
Yes,
Okay.
I get headaches.
Okay. Oh yeah.
Terrible headaches. Like here, awful. And I don't know if I have trigger points in my forehead, but it was like a form of acupuncture, and it felt so good. And now my headaches.
So that's a huge
okay.
point.
Yeah.
So
I like it.
botulism toxin is actually used to treat migraine headaches.
Yeah.
And I'll talk real quick. The theory is your nerves come through little holes in your skull, foramens, and they're surrounded by muscles. And some people get headaches because the muscles irritate the nerves as they come through. And
Inflammation of the nerve.
inflammation of the nerves. And so we believe that the Botox calms down that inflammation by decreasing the movement of the
That's right.
and that's really came from the aesthetic industry. People were coming in, just like you said.
A side effect. They were
A
coming
side
in for
effect.
pretty Botox.
Right. And
but they're like, whoa.
It's like you. Oh my goodness, my headaches feel a whole lot better.
Yeah.
So there is definitely a very medical necessity for it. But I'm sorry I interrupted you there.
I know. No, you're fine.
Yes, the more you know.
So do you think? So you actually think it? So it did. So with that, but the actual injection was not as bad as you thought, right?
No,
Because
it
of your
was
fear of
literally
needles.
lasted 2
Okay.
seconds. It was easy. But now, I know like I don't get the full dose, so it take like the timing, might be like 3 to 4. I think mine's like 2.5 to 3. And it kind of starts coming back a little bit, but it's not as harsh as
Correct.
it once was.
Right.
But whenever my headaches start coming back, I'm like, okay, yeah, I need to go
it's
back.
time.
Really?
It's time.
Yeah.
Do you feel like you had lines in your forehead that you do not have anymore? Did you have any etched lines yet or not yet?
I had a little bit of etched lines. Like I had a little dent right here whenever I raised my eyebrows, and it was like really weird because like everywhere else was like this way, and then I had like a little dent. It was the weirdest thing. But now it's just softened up, and it's not as noticeable. And my friends are super jealous.
Really?
That's
I was about to
okay.
ask you, how did your friends
I was
react?
about
How did
to-
your friends and family react?
Well, I told them, I was like, yeah, I'm gonna go get Botox. They're like, huh? What?
Right.
It's the
Right.
not so
You don't,
judge-free
you don't
zone.
need that.
You don't
'Cause this
need that.
was-
That's
You don't need
and this
that.
was because remember, this was a couple years ago, right? When you
Yeah.
started, so you were like an early, as usual, trendsetter. But you were early on it, right?
Yeah, yeah. And so
Right.
my mama, she's like, what? You don't need that. I don't even get that.
Right.
And I'm like, well, Gail, it's time. And
Maybe you should come with me.
yeah, right.
and I was a senior in college, so I was telling everyone in my sorority, like,
Right.
hey, y'all, I'm gonna get Botox. And they're
Right.
like, huh? What?
Right.
And so I got it, and then like 2 weeks later, everyone's like,
Wow.
wow.
Yeah.
Amazing.
And
What
so-
did it do for you beyond a couple of wrinkles? Did it make you
It
feel
honestly,
good?
It made me feel really good because I don't know. It's just like I felt fresh. Like
Yeah.
I felt like a little glowy,
Mm-hmm.
and like my makeup gets applied on much better because
Yeah.
the makeup's not going into the grease
Into the crease.
and everything. So I just felt a lot better.
Let me ask you this: did you feel so? As a plastic surgeon, I like to say that we don't. What we're doing is we're really giving people confidence. Is that a word you can use?
Absolutely,
Okay.
absolutely. And I also got a little lip flip.
Mm-hmm.
So whenever I smiled, my lip like didn't turn all the way in, and I wasn't as teethy, as one of my friends said. She
That
goes, "You're a
teethy
lot
gummy
teethy."
smile
That
some
is
people have,
teethy.
right?
So you plan on maintaining, like you said, every 3-ish months for the foreseeable future, just to.
Yeah, it's been 20. I started when I was 21. I'm turned 24, so it's been 3 years now. So
What would you tell a naive patient?
do it, YOLO.
Do it.
Jump off the fence.
Yeah.
Like there's no harm, and if you don't like it, just don't do it again.
Yeah.
And it also like do your research on your injector. Just don't go to Mexico.
Right. Don't go to
Or
Mexico.
don't get it on the
No.
cruise.
Right.
And I think that's very important because, like she was, you're saying, everybody's looking at social media and they're seeing these things. Make sure, like, just because somebody's put on social media, like,
Yeah.
I think it might not be the best injector.
Yeah.
You know what I'm saying?
I mean,
so like make sure you know who your injector is.
Anybody with a
And
medical license can do it.
anybody.
Yeah.
Anybody.
And it's available in every corner. But so is, food.
Yeah.
And food,
I mean-
you don't necessarily want to eat your dinner at the Circle K.
Yeah, exactly.
So,
Golden Corral.
Oh, Golden
Yes.
Corral. Yeah.
Do your research.
Yeah, and
Right.
And also, like, I think also, with Botox, you're also paying for the experience. Like, I don't think you can just get, like the one-on-one full consult everywhere.
Right.
Yeah.
Somewhere might be doing $10 a unit at a Botox party, but I'm not getting that one-on-one care
Right.
or, kind of like the
Assessment.
Yeah, the assessment.
The assessment, that the good feeling, the judgment-free zone, the follow-up, right?
Yeah.
The making sure that what you're paying for is what you're getting, I think is very important.
Absolutely.
And not to even mention the counterfeit Botox in the world.
Oh, that's
that
a whole
is
different discussion.
That's it.
trending.
Yeah.
I mean, you need to
Yeah.
go to somebody who you trust, is in a medical facility. And
Well,
you're in
somebody
good
with an excellent
hands.
reputation. I mean, Taylor's been doing this for 15 years. Yes, we're both part of a large group, but people come to her. 95% of her patients are walking in the door are repeat customers that have been word of mouth, right?
Yeah,
And,
definitely.
and it's important to have a relationship with your injector or your physician, the clinic that's doing your anti-aging medicine. It's relationships are everything, because medicine's about trust. This is medicine, we got to say, right? Botox is used all throughout the body for headaches. It's used in your stomach for reflux.
TMJ clenching,
TMJ
cerebral
clenching.
palsy.
I mean, there's a bazillion different uses. So we are, everyone at this table except for our patient is a medical provider with extensive medical training. So you do have to think about all that. It's a mesh, right?
Yeah, and even though I also feel like even though it's cosmetic and all this kind of stuff, it's a very vulnerable place that you're
very
in
vulnerable.
to be like, hey, I don't like this
Yeah.
about myself.
Yeah.
So being able to have the experience that you were able to have and like be open with the injector and just how to, and once again, that judgment-free zone I think is
Right.
huge.
I always say that the thing that I think prevents people from doing these types of, whether it's Botox to hormones to tummy tucks, is fear.
Fear.
Right?
Yes,
fear
absolutely.
of being judged.
Yep.
Fear of results. Fear of or bad results, or fear of what people are going to say about them. Right. I tell people is just find a place where you're comfortable and you feel welcome, and let it all out there. Trust them. If they have a great reputation, there's a reason for that. But it really is fear. It's fear that keeps us from becoming the best we want to be.
Yeah. I like that.
Anything else to add, Parker, as our baby Botox
I know.
model
Queen.
I know.
Yeah.
I love it.
Okay.
I recommend it to all my friends. I am a little trendsetter.
You are a trendsetter.
Okay.
Known you for a while. You're definitely a trendsetter.
The was it micro influencer that we learned about last week?
Like micro.
Micro. You're an
Micro-
influencer.
Very borderline.
I have one more question before we go. Have you heard of, it's trending on TikTok, and I'm probably going to butcher the name, Olive. It's a topical Botox.
Wait, yes, I have.
Okay. That everybody is younger, 18 to 20-ish, are talking about. It is a lotion
Okay.
that you place on the skin. So I want you to debunk that.
So this is not an FDA approved device,
this
right?
is not FDA
Okay.
approved. Do
So-
you remember Revox from
Yes.
Revision a long time
So
ago?
there was one in the works that was going to be placed only on the crow's
Correct.
feet,
Correct.
because the skin of the face thins as it gets closer to the eyes,
Mm-hmm.
right? So I always tell patients lower lids is actually the thinnest skin of your face. Here is fairly thin. There was one in development went through the FDA process, but did not make it.
Mm-hmm.
So there is no topical Botox out there. Do not waste your money.
Yes. Yes.
Yeah.
It's like those that say it's like it'll be super flat for 10 minutes and it's going to be gorgeous. And then like when you wake up the next day, it's like, oh, there it is.
Just
There
like-
Come
it
in
is.
for a skincare consultation. That is not the answer.
That's not the answer.
Yeah.
Topical, right?
That's
It's one of those social media.
Yes,
myths.
it is.
Yes.
Okay.
No.
Okay.
I'd inject it all day. I wish that I could say that I was a baby Botox.
Yeah, right,
But I
right.
am not.
We're beyond that.
I am a full-blown Botox member at this point.
And Britt, I'm over here eating a Big Mac. So, all
So,
right, take us out of here, Britt.
all right. Well, thank you, Parker. Thank you so much for coming in and sharing your experiences and everything with us today. Taylor, for your expertise on this. We really appreciate it. Thanks for tuning in to the Consult Before the Cut. We hope you found valuable insights to guide your journey. Remember, every decision counts. Take your time, seek advice, and always consult before you cut. Until next time, stay informed and stay inspired.
Thank you, guys.
Bye.